Good day and welcome to the Primary Healthcare module for 2021. This module is also referred to as HDP. I am Luzon Africa and I'm the course convener for this module. The picture you see at the bottom of the slide is me in my pre-COVID days where I was unable to hide behind my laptop. So I definitely look a bit different to that picture. My background is in physiotherapy and 12 years ago I sat in front of my HDP lecturers. So this to me is a massive honor to be presenting this to you. In this session you will learn more about who your lecturers are, what the online platforms are that we'll be using in this module, how you can access the different information or resources, where to direct questions or queries that you may have regarding the module, the layout of the course, and how you will be assessed. This module is your first exposure to the interprofessional curriculum offered at UWC. As can be seen on this slide, a scaffolded approach is used to ensure that you obtain different skills and knowledge sets to ensure that you are able to practice interprofessionally once you graduate. At the first year level, a theory module called Primary Healthcare is offered to you. To ensure interprofessional interaction, the pharmacy, dentistry, and oral hygiene classes have been split into 5. Each fifth of the class will go with one lecturer. Unfortunately, we don't have pictures for all the lecturers, but once you receive your email notification indicating in whose class you are, you will be able to put a face to the name. Please note that the divisions of these classes are final and you cannot change your lecturer to be in the same class with other classmates or your friends. The lecturers will send you a link to join the class WhatsApp group or to join whichever platform they choose to use for the rest of the term. Prior to the commencement of the second term, you will be added to the HDP eCanva site. To access any information about the course, the Student Course Guide for 2021 can be found on eCanva under the Course Resources e-tool of the HDP 111 T2 2021 site. I will request that all lecturers share this guide with their classes via WhatsApp. The course guide will give you all the information needed for lectures and assessments. And in this guide, you'll also find my contact details. The HDP module will be conducted completely online and the following platforms will be used. eCanva is UWC's learning management system as it is a 0-rated platform. On eCanva, we are able to embed YouTube videos, post announcements, share resources, and you can upload your assessments. As mentioned previously, you will be added to the HDP 111 T2 2021 site. If the site does not appear on your list by the start of term 2, please email me. Google Meet is the next platform that we use. All lectures will commence on the 5th of May and will take place at 2 o'clock on Google Meet. The only time you will not have a Google Meet lecture on a Wednesday at 2 p.m. is if your lecturer communicates something different with you. The next platform is WhatsApp. HDP is an interprofessional module. This means that in this module, you will learn with, from, and about topics with other disciplines. In your classes, you will thus be subdivided into interprofessional teams. In these teams, you will complete tutorial tasks and a team assignment. To make team chats easier, you can use WhatsApp as it is user-friendly and has relatively low data costs. As a team, you could choose a different chat app, for example, Facebook Messenger, Hangouts on Google, or whichever other platform someone in your team recommends or suggests. This slide indicates where you can direct specific questions or queries. For general queries, please make sure you contact your lecturer. General queries include information regarding your lectures, assessments, and your team allocations within your smaller classes. Any administrative queries needs to be directed to Mrs. Mariam Saleh. Administrative queries include class allocations or late registrations. For any mark adjustment queries such as being awarded credits for the module or applying for associate status, please obtain the needed or the necessary forms from our faculty office, and for that you can speak to Mr. Keegan Cox. For any further module-related queries such as signing your credit application forms or challenges you may have with your lecturer, please feel free to contact me, Luzon Africa. For HDP, your continuous assessment mark or year mark contributes 60% to your final mark. Your continuous assessment mark is comprised of 4 different assessments, and these all have different weightings in how they contribute to your continuous assessment mark. Explaining this can be rather challenging, so if you are struggling to understand, please feel free to email me and I'll gladly explain it to you further. The 4 assessment tasks that will contribute to your continuous assessment mark is your IPE portfolio, your team assignment, 2 tutorial tasks, and a participation mark. Please note that your lecturers will explain these in detail once you start the module. Your summative assessment will contribute 40% to your final mark. So your summative assessment together with your continuous assessment mark will calculate your final mark at the end. Your summative assessment only consists of 1 assessment. This is usually a sit-down examination. But given the COVID pandemic, we've resorted to a take-home examination. In this case, the examination paper is uploaded onto Canva and you are given 24 hours to work offline in a Word document and re-upload it onto Canva. This will be explained in greater detail as we move closer toward the exam period. As explained in the previous slide, your continuous assessment mark and your take-home examination will contribute toward your final mark for HDP. The HDP module is divided into 3 themes. Each one of these themes will have an assessment, and those assessments contribute to your continuous assessment mark as explained previously. As future health professionals in South Africa, we need to understand that the South African context is completely different to that of other countries. As a low to middle income country, we are faced with a quadruple burden of disease, which means that our people's health outcomes are poorer compared to that of other countries. It is thus important to incorporate innovative strategies that ensure that our health system is strengthened. Interprofessional teamwork is one of those. And so to start this module, we need to understand the theory behind interprofessional teams, what it means to be within an interprofessional team, what makes an interprofessional team effective, and how it contributes to an improvement in patient health and in collaboration between different health professionals. Now, that you understand what interprofessional teamwork is, we can move to an introduction to health. In the introduction to health, we need to understand that given our different cultures and backgrounds, that we all view health differently. In this theme, we unpack what health and wellness means. We develop an understanding of the different dimensions of an individual's health. We also unpack the different determinants of a person's health, which means what are the different factors that contribute to the health of an individual. Once we have a deeper understanding of that, we start moving into the primary healthcare system. So the primary healthcare system is the first interaction a patient has with the health system, and thus it is so important for all of us to have a shared understanding of what the primary healthcare system is. But as I've just mentioned, South Africa has a completely different context to that of other countries, and so we need to understand primary healthcare in the South African context. Once we understand that, we look at how we can incorporate a tool to ensure that we look at a person's health as far beyond the disease alone. And we call that comprehensive primary healthcare approach. And so we will unpack that in the second theme. A big part of the primary healthcare approach is the involvement of communities in our health system. The development theme, which is the last theme you'll be working on, looks at communities. It looks at the health of our communities. It looks at understanding the communities that our patients come out of. We start by looking at our own communities and trying to understand that, and then applying it to a health scenario. All of these themes, at the end of the day, if you read your student course guide as provided, there are specific outcomes. So once we work through all three of those themes, you should be able to have achieved those specific outcomes as expressed in the beginning of your course guide. It sounds like a lot, only because we haven't gone through the content yet. Your lecturer will be with you every one of those weeks. So the small number next to the theme, interprofessional teamwork and teams, is a 2. Introduction to health, 3. Development, 3. Those are the weeks that we will spend sharing additional content with you. So under the course resources tab on Canva, you already have narrated PowerPoints such as this one that will give you the bulk of the theory needed for you to understand the theme. But your lecturers will use those 2 or 3 weeks to unpack the content that was given to you in those narrated PowerPoints. And through that, you will use those assessments to ensure that you actually understood what was covered in those different lectures. Because we are working online, you will need a device and data. If you are in need of either of these, please click on this link and complete the questions within that link. Thank you for watching this video. Should you have any questions, please feel free to contact me, Luzon Africa, at lkock, that is LKOCK, at uwc.ac.za.